Welcome to familydoctor.expert. I'm Dr. Grant Blashki. Today we're going to talk about why you don't need antibiotics when you have a cold. Every year there are millions of GP consultations and there's some good reasons not to take antibiotics. The first reason is they won't work. Antibiotics only target bacteria and most respiratory infections are actually viruses. So particularly one called the rhinovirus, but there's actually about 100 other possible viruses as well. Typical viral symptoms: runny nose, a mild fever, possibly some headaches, sneezing, mild body aches, usually lasts about 3 or 4 days, can last a week or two, and sometimes there's some minor nausea and vomiting, and that's a pretty typical virus. So no point taking antibiotics for that. Second reason not to take antibiotics is they have side effects. They upset the balance of the normal bacteria in the body and can cause diarrhea and can cause thrush and other problems. They can also have some serious side effects, very rarely, but I have seen a couple of cases where just routine antibiotics have caused severe problems like liver failure and those sort of things. So although it's safe to use them when we need them, there's not a good case to use them unnecessarily. The next reason not to take antibiotics is they can interact with other medications that you're on, particularly for women who are on the oral contraceptive pill. They stop the pill working and they interact with lots of other medications as well. The fourth reason not to take antibiotics just for a cold is that we have a war going on between our limited antibiotics and the bacteria, who are constantly evolving and learning all the tricks of the various antibiotics and becoming resistant. So if we use the antibiotics unnecessarily when we really need them, when people are really sick in hospital, the bacteria will be resistant. So that's a really good reason not to use antibiotics unnecessarily. So sometimes antibiotics are required. What are those times? Sometimes people get a chest infection where they get bronchitis or pneumonia, particularly some people who have asthma or emphysema are at risk, and then antibiotics are required. Some people get pain in the cheeks here or pain in the forehead, what we call sinusitis. Antibiotics can help there. Another indication for antibiotics is tonsillitis. Have a look in the throat, you see big pussy tonsils, great idea to have some antibiotics. Ear infections sometimes, ear pain, or the doctor has a look and sees a big red eardrum, antibiotics can be helpful in this situation. There's another situation where we see what we call a strep throat caused by the streptococcus bacteria. This is well worth treating with antibiotics, not only because it gets rid of the sore throat, but the streptococcus bacteria can cause some long-term kidney and even heart problems. The other situation where we will use antibiotics for respiratory infections are people at high risk. People who've had lots of chest infections or sinusitis or tonsillitis. Maybe their immune system's compromised. They might even be of an indigenous background, and we know people of indigenous background tend to get more of these sort of bacterial infections. So these are some of the reasons why the doctor might suggest antibiotics. But for the good old garden variety cold, absolutely no need. What are some red flags where we're a bit concerned? Well, one of the differential diagnoses for a cold is what we call influenza or the flu. Now, in a colloquial sense, a lot of us will say, oh, I've got a bit of a flu, and they actually mean they've got a cold. But the actual influenza virus, people can get quite sick. They get typically not the mild fever of a cold, but a high fever, severe muscle aches. Often they get the shivers, and usually the timing of this is during a sort of an influenza epidemic, usually around winter or spring, so the doctor thinks of it. So what can you do for a cold? If you can't take antibiotics, what are you going to do? Rest, obviously, drink lots of fluid. There's a bunch of remedies. Lemon and honey tea or warm drinks are helpful. Lozenges are useful. You don't have to get the really expensive ones, just the ones from the milk bar or the 7-Eleven are totally fine. Paracetamol if you've got a fever. Nasal sprays temporarily to unblock your nose can be useful. Don't smoke if you're a smoker. There's some evidence for echinacea that's worth a try. But the things that aren't going to help are antibiotics, The cold and flu tablets, in my view, don't make much difference. Maybe some slight symptomatic improvement, but really not particularly recommended, and don't get rid of the virus. Remember, you can't give aspirin to kids. It can cause a rare but serious disease called Ray's syndrome. And the final thing to say about colds is don't give it to other people. Wash your hands. Make sure you throw out the tissues. Don't go to work or to school too early and give it to everyone else. So there's a few tips about colds and antibiotics, and I wish you well from familydoctor.expert.